That's a lot of question for someone who has just figured out, right? And suddenly you have to make a life decision who does not even have a life partner.
Less than 35 years of age, quality of the eggs is little better. So you need at least 10 to 12, maximum 15 oocytes that can be retrieved in one IVF style. But intent is very important for a couple to stay together. If they are wanting to have a child, that's the best intent both of them are having. That's the family goal.
I'm sure आपके बहुत अच्छे cases भी होते होंगे, someone who has gotten hope, someone who's happier. Can you share some stories with us?
This lady had 2 pregnancies because of blood flow problems to the uterus. She had lost the pregnancies at 6 to 7 months. So she was petrified. That's where I told her, I'm not God, but I will give you the best possible.
Hello and welcome to Start Your Joy. I'm Utkarshica, a content creator and cybersecurity expert. Today we have someone who has 16 years of experience as a gynecologist dealing with IVF and high-risk fertility cases. She is the director at ACME Hospital, Chembur, and has helped over 10,000 couples. We're very excited to have you, Dr. Neelam Bhise. Very important question for me. I recently turned 30. Do you think I'm too late to freeze my eggs?
See, awareness is the first key, and you have awareness. Congratulations on that. Now, next thing is what is egg freezing? Is suppose you're 25 years age, every month you get once period. 40 years of age, you get once period. So every month the cycles are coming. So olden time women used to feel I'm still menstruating. I do have my eggs and I can plan anytime. Now what is happening? Girls like you are having knowledge that with age, the quality of eggs is going down. Does that mean that every woman should freeze their eggs? That's the main important aspect
Right.
we need to understand. So I would tell you how we should, as a doctor, I counsel my patients. Like I have a girl who I have been treating for PCOD since her adolescence. Now she's 30. She's seeing someone. Both are now traveling to US for pursuing their masters. And she came with the future partner. They were quite sure about each other. But still, she said, Doctor, I complete my master's, I figure out my career. By the time I'll be late, so do I want to freeze? Can I freeze my eggs? Now, the main important point was she was a patient of PCOS. So, there is a difference when you should freeze the eggs for every individual according to what is their egg reserve, what is their body telling them. So for this girl, since I knew her since long years, and I knew that 2 years time she will figure out. See, there is a sweet spot for freezing eggs,
Acha.
age wise. So that sweet spot is different for everyone. Like for somebody who has very good egg reserve, they're not yet sure about things. But if the person, ideally between 30 to 34 years of age or 30 to 33 years of age, freezes the eggs, is the time when they are emotionally mature. They know their career and their relationship timeline. And then they go for egg freezing, knowing that they are going to further delay their childbearing for any reason. Now, if somebody has very low egg reserve, like somebody has an endometriosis, so what happens? We have AMH, that is the test which we do for knowing the egg reserve. Along with that, we do sonography, that is transvaginal ultrasound. So, by these two simple tests, what we understand is what is the person's physiology and what is her reserve, which she is going to slowly exhaust. So, if her age is in favor, like 30 years age, if she has low AMH, even 30 is good time to freeze the eggs.
बट ये सेलिब्रिटीज इतना बात कर रहे हैं वन देयर आर टू काइंड्स ऑफ सेलिब्रिटीज वन जो एंड्रोमेट्रियोसिस के बारे में बात कर रहे हैं श्रुति हसन एंड ऑफ कोर्स माई सेल्फ बट देर आर पीपल हु हैव ऑल्सो स्पोकन अबाउट IVF राइट वेरी ओपनली सेलिब्रिटीज जो ओपनली IVF के बारे में बात कर रहे हैं सो देर आर डिफरेंट काइंड्स ऑफ ओपिनियंस to each, right? Someone like me who went through surgery last year, right? Do you think in that situation, so the doctor in my situation, उन्होंने her first question was when are you getting married? Are you planning to get married? Do you think you want to have a child? Now that's a lot of question for someone who has just figured out, right? And suddenly you have to make a life decision who does not even have a life partner, right? So, and someone like myself, and there are so many people and so many women out there who have focused on their careers for the longest time, and now have figured that there are of course IVFs and the other areas that we need to focus on. But ये egg freezing is still very unknown, right? कब करना चाहिए, um, उसको कितना time reserve करना चाहिए, when is the right time, and what if I don't find the right semen? There are so many questions like that. So I'm sure you mentioned that you counsel as well. So someone who probably in my situation, who has gone through a surgery, who is figuring out life, still not sure whether they want to have a child or have a life partner, when will they have it? What's your ideal suggestion, recommendation to someone like myself?
So, for this situation, what we should look at is when we are freezing the eggs, we need at least for less than 30 years of age to get at least, suppose out of all eggs, get a 60 to 65% success rate of all the frozen eggs. How many number of eggs you need to freeze? So, less than 35 years of age, the quality of the eggs is little better. So, you need at least 10 to 12 oocytes, maximum 15 oocytes that can be retrieved in one IVF cycle. So, in one egg freezing cycle, you get 10 days injections, that is subcute injections. You can go to office, you can work during those times. At the last day of the injection, that is the 10th day, there is a trigger shot at night. The 12th day, 1 day gap. 12th day, we call for a admission. The admission is half day. The person undergoes sedation. There is no general anesthesia or spinal anesthesia. Under sedation, the person undergoes a transvaginal egg retrieval. That's a procedure. Now, in that procedure, there is emotional involvement, there is financial involvement, and there is a insurance for future. But let me tell you, only almost 60% of the women who have frozen their eggs actually might not come for the use of those eggs in later. Why? This number is going to increase slowly because now people are actually, women are freezing the eggs for future use and they are practically doing it. The number of women for whom egg freezing I have done has increased over last 8 to 10 years time. Since last 2018 we are doing egg freezing, and from that time the number of women who are opting for egg freezing has increased. At this time what I tell them is, when you have good egg reserve, that is the point in time when you freeze the eggs. Even if you freeze 10 eggs, you get 8 to 9 eggs at the time of making the embryo. So you need to have realistic understanding about things. Another point is, when you have very low egg reserve, then as the age, suppose person is 37 plus and their AMH is less than 1.51, they can still freeze the eggs, but the quality and the percentage of the eggs will be less. They will need multiple cycles, expensive cycles, to pool that many number of eggs, and that is the point in time the results will be little suboptimal. So if you actually have awareness about your AMH and about, as you are saying, you have undergone a endometriosis surgery, so we have to see if the endometriosis surgery has further reduced the egg reserve. Okay, so these all aspects needs to be understood, and the doctor has to be absolutely clear about, when we are doing the procedure, to tell the right thing. If you need egg reserve, we should do it, because I do have lot of celebrities who are in their. I have one person who is 40, somebody is 46, and they are so beautiful women, all knowledge, all access to the world, but they say, doctor, I didn't know I could freeze my eggs, and now I do not have that many eggs. And it really happens to it can happen to any person at any walk of life.
So let's say, have you had any patients where they have freeze their eggs, okay, and they have taken all the necessary precaution, but they end up with a partner whose semen quality is low?
So now we are moving on to understanding the male factor, male
Yeah.
person. So partner is very essential. So whether the person is doing egg freezing or whether the person is struggling with fertility and they are going for an fertility treatment, what happens is when we are starting the fertility treatment, women undergo a lot of dye test, blood evaluation. But the wildest part is sometimes sperm test is not done, and the most important thing is the semen analysis is the most cheapest. It is done in 30 minutes. It is the most important aspect of the male fertility which you should see. And if the semen, like with advancing age, urban lifestyle, vaping, smoking, bad lifestyle, oxidative stress, the heat, the heat trap, like keeping the laptops on the lap, using hot tubs, lot of things are causing tremendous decrease in the male count and motility. Now these things, if we see globally, almost there is a decline in male fertility by 50%.
Hmm.
That means what it was 15, 20 years back, now it has reduced to 50% of what the sperm count and motility was there across the world. So these factors are not only lifestyle, there are a lot of medical conditions also, but what is correctable in our hand, we should correct.
The quality decline, like how women, we say ki 30, 32 at certain age, you have to start focusing on either freezing eggs or having a child. क्या ये मेल के लिए भी लागू है कि
But we say men will till they die, they will have millions of sperm in their body. But paternal aging is also an important factor for deciding the child's outcome. As the age progresses, the DNA fragmentation index of the sperm increases. And if the DNA fragmentation index is increased, the quality of the embryo means the baby which is forming, whether that embryo is forming inside, like natural conception, or whether we are making an IVF,
Hmm.
the sperm decides the blastocyst formation. Like blastocyst, it's a new name, right?
What does it mean?
Yeah. So when we are having one egg and one sperm, we unite. That's a day zero, the same day when the egg and the sperm are united. So from that day zero, every one day counted, day 3 and day 5 are the main milestones. On day 3, the embryo reaches to 6 to 8 cells. That's a cleavage stage. And that is day 3 embryos. Suppose you have 10 eggs. If male factor is good, you have 8 day 3 embryos, because all embryos will not grow till day 3, day 5. Out of those 8, sometimes we get 6 to 7 blastocysts, that is day 5 embryos. And if you have that many number of embryos, the comfort is going to be always there, because number of blastocysts, the good quality embryos, finally culminates in pregnancy. In my 16, 17 years of my practice, I have always told my patients say, like they touch feet and they say, Doctor, you gave us a baby. I said, see, I did a scientific work. We are reproductive specialist. But what has given you the pregnancy is your embryo.
Hmm.
If the embryo is good quality, rest of the things also are important, like the uterus condition, the endometrial thickness, the body metabolism. There's a lot goes, but those are all correctable factors. I do not jump into IVF directly. I usually prepare the person's metabolically, health wise, their uterus is okay. Finally, only the gametes have to give the good embryo. And the sperm is actually playing a huge role in giving you good blastocyst. Now, if the sperm count is less, out of 10 eggs, sometimes you get 3 or 4 blastocysts. So, less than 50% blastocyst formation. That becomes a factor which could have been corrected before starting the IVF cycle. There is one more important thing is for the sperm count. I'm talking about so much about the sperm being the most important factor as equal to the female factor. The sperm, there is a cycle of 74 days.
Hmm.
So, what is this magic number? So, sperm which is ejaculated today was made 3 months back. That's the life cycle of the sperm to get matured.
Okay.
So if somebody starts correcting their lifestyle and correcting the what can be corrected in their health, within 3 months they have to be consistent. अगर कंसिस्टेंट रहेंगे तो 3 मंथ्स के बाद स्पर्म काउंट और मोटिलिटी में जो भी एक्सरसाइज और एक्सटर्नल फैक्टर्स की वजह से जो डैमेजेस हुए हैं वो करेक्ट हो सकते हैं. 3 मंथ्स के बाद ही हमें चेक करना चाहिए. आज करेक्ट किया लाइफस्टाइल और कल स्वीमेन एनालिसिस में इम्प्रूवमेंट आ गई, ऐसा नहीं हो सकता.
I see a lot of young men suddenly, if they have chosen parenthood, right, they start taking care of themselves. I've seen some of those as well started, like, doing exercises and everything.
Yeah,
So
yeah. I
because
had a
it is a,
patient who was a civil engineer, always on the construction site. Wife was 28, regularly menstruating. She had no problem, and they were given a label of unexplained infertility because apparently his count was okay. What happens when we do the semen analysis, the expertise to see, we give videos of, like, how the sperm should be seen and how it is seen. So when you see the sperm moving actually in the video, you understand that how many are actually linear motile sperms. And this particular situation, the husband had a lot of heat exposure, construction site exposure, and he was a very well read person also. So when we discussed this point, okay, so he said, let me try to change my lifestyle and everything. And of course, he was smoking also, so he reduced that. And within, usually I say 3 months' time, within 1.5 month time, by the time his wife was ovulating, only on IUI, okay, the couple conceived. So there was a bit of a effort from patient side, bit of a effort from science side, but natural pregnancy. IUI is a natural pregnancy. We just inject the sperm into the cervix when the person is ovulating. And that is the most beauty. अगर नेचुरल प्रेगनेंसी हो पा रही है, असिस्टेंस के साथ नेचुरली कंसीव हो पा रहा है, तो वो पहले ऑप्ट करना चाहिए.
आई थिंक गाइडेंस और कंसल्टेशन काफ़ी इंपॉर्टेंट है. लोग जब सोचते हैं कि आईवीएफ फर्टिलिटी क्लिनिक में जाना है, इसका मतलब वी हैव टू गो थ्रू दैट लॉन्ग प्रोसीजर.
Yes,
ये वो.
and once they walk a fertility clinic, they consider कि अब ये IVF ही बताने वाले हैं.
हाँ.
So ये concept ही fertility doctor और IVF franchise are two different things. So when somebody is a fertility doctor, they usually practices are very standard in Mumbai region. So when fertility doctors see, usually we try to correct the hormonal problem because there is a myth that हम IVF करेंगे हमारे हार्मोन डिस्टर्ब हो जाएंगे. करेक्ट. अब अगर किसी के हार्मोन डिस्टर्ब्ड है एंड अगर उसे हम IVF कर रहे हैं तो वो हार्मोन डिस्टर्ब ही होंगे.
लेकिन वो टेस्ट और गाइडेंस ज़रूरी है.
करेक्ट. तो हमें थायराइड, प्रोलैक्टिन, पीरियड इरेगुलरिटी को थोड़ा कंट्रोल करना, PMOS, जैसे हम इससे पहले PCOD बोलते थे, PCOS बोलते थे, अभी हम उसे PMOS बोलते हैं. तो
व्हाट इज दैट?
पॉलिसिस्टिक ओवेरियन डिसीज,
Yeah.
हम अभी उसे पॉली एंडोक्राइन मेटाबॉलिक सिंड्रोम कहते हैं क्योंकि उसका भी बड़ा एक स्टोरी है. पीसीओडी, जैसे हम पहले देखते थे, गर्ल्स आते थे पीसीओडी का रिपोर्ट लेके कि डॉक्टर मेरे ओवरी में सिस्ट है, डू आई नीड अ सर्जरी, बिकॉज ये टर्म बहुत कंफ्यूजिंग होती थी और ये वर्ल्ड वाइड नोन टर्म थी. तो इसे एक्सप्लेन करने में कि नहीं सिस्ट नहीं है, ये एंडोक्राइनोलॉजिकल प्रॉब्लम है. पीसीओडी में क्या होता था, बहुत सारे अलग अलग फिनोटाइप्स हैं. जैसे किसी का पीरियड बहुत लेट चल रहा है, किसी के एक्ने हो रहे हैं पर पीरियड रेगुलर है, किसी का वेट गेन हो रहा है, किसी को हेयर ग्रोथ ज़्यादा है. तो हम सब पीसीओडी को एक ही फिनोटाइप में ट्रीट नहीं कर सकते. तो इसलिए अभी वर्ल्ड वाइड कॉन्सेंसस होके पीसीओडी का नॉमेनक्लेचर चेंज हुआ, उसके अलग अलग फिनोटाइप्स डिसाइड हुए. फिनोटाइप्स यानी जो कैरेक्टरिस्टिक आप दिखाते हैं उसे फिनोटाइप्स कहते हैं. तो उसके कैरेक्टरिस्टिक डिसाइड हुए कि PMOS के कौन से फिनोटाइप्स है और उसका ट्रीटमेंट होते गया. तो ये करेक्ट करते हुए अगर कोई PMOS की पेशेंट के पीरियड अगर रेगुलर करे बिना पिल दिए, अगर पीरियड सपोज 70 डेज का साइकिल है, 2-2 मंथ का साइकिल है, किसी किसी को टैबलेट लिए बिना पीरियड नहीं आ रहे हैं, तो वो PCOD या फिर PMOS को हम कंट्रोल करते हुए डाइट, लाइफस्टाइल, एक्सरसाइज, हर चीज़ से हम उसे कंट्रोल करते हुए, सबसे इम्पोर्टेंट गट इश्यूज़ को ठीक करते हुए करेक्ट करेंगे. अब क्या होता है कि जो भी स्पेशलिस्ट है, सपोज एंडोमेट्रियोसिस को कोई स्पेशलिस्ट ट्रीट कर रहा है, तो उसे गट हेल्थ ठीक रखने का भी नॉलेज होना चाहिए। ऐसा स्पेशलिस्ट होना चाहिए जिसके अंडर ये सब आप एक, बिकॉज पेशेंट डॉक्टर को इन एंड आउट पहचान सकते हैं। अगर किसी को एंडोमेट्रियोसिस है और जिसकी शादी नहीं हुई, जैसे आप खुद की केस बोल रहे हो कि एंडोमेट्रियोसिस है, यू आर नॉट येट सेटल्ड। नाउ बिफोर अंडरगोइंग सर्जरी पहले हम ये बोलते हैं कि अगर ओवरी के अंदर एंडोमेट्रियोसिस है तो उसे आप जहाँ तक हो सके ऑपरेट मत करो। ये पर्सनल ओपिनियन नहीं, पूरे वर्ल्ड में ये गाइडलाइंस है कि इंट्राओवेरियन एंडोमेट्रियोमा, अगर पेशेंट को पेन नहीं है, एंडोमेट्रियोसिस में क्या होता है, पेशेंट को ब्लोटिंग होता है, वेट गेन वेट लॉस के साइकिल्स चलते हैं, कॉन्स्टिपेशन होता है, लूज स्टूल्स होते हैं, पीरियड में बहुत सारा पेन होता है, दिस इज मूड स्विंग्स होते हैं, फ्लक्चुएशंस चलते हैं। अब ये सब चीज़ें जब हम स्कैन करते हैं तो हमें पता चलता है कि ओवरी में सिस्ट है। सो अभी हम जो अंडरस्टैंड कर रहे हैं कि एंडोमेट्रियोसिस में सर्जरी या फिर फर्टिलिटी, एग फ्रीजिंग करें या आईवीएफ करके एम्ब्रियो बना के रखें या फिर हम गट इश्यूज को ठीक करें। सो हैविंग ऑल दीज थिंग्स फ्रॉम बिगिनिंग एंड नोइंग फ्रॉम द डॉक्टर पॉइंट ऑफ व्यू कि मेरे पेशेंट का अभी एज क्या है, अभी उसे सिम्टम्स कितने हैं, अब मैं सर्जरी करूंगी तो उसके बाद विद इन 1 ईयर 2 ईयर्स एंडोमेट्रियोसिस कैन कम बैक। सो अब मुझे पेशेंट का पहले ये देखना है कि व्हाट इज़ करेक्टेबल, उसका गट इशू ठीक करना है, हेल्थ, मेटाबॉलिज्म, लॉट ऑफ टाइम, विटामिन ई और थोड़ा पेशेंस। बट क्या हो जाता है कि अगर मेरे पास आगे की फैसिलिटी नहीं है, दैट्स नॉट करेक्ट। यानी अगर मैं किसी को गट इशू ठीक करके एंडोमेट्रियोसिस को ठीक करी, बट आई हैव द एक्सपर्टीज कि अगर सर्जरी लगा तो मेरे अंडर हो रहा है, फर्टिलिटी ट्रीटमेंट लगा, एग फ्रीजिंग लगा, आईवीएफ लगा, तो दैट ऑल्सो आई एम रेडी टू डू इट। सो देन आई हैव नो हेजिटेशन और लिमिटेशन टू एडवाइस टू द पेशेंट। देन इफ आई स्टार्ट विद दिस स्लो अप्रोच, सो मेरा पेशेंट का टुवर्ड्स कमिटमेंट इज लॉन्गर। कमिटमेंट क्यों ज़रूरी है? क्योंकि अगर हमारे एंडोमेट्रियोटिक सिस्ट है और सिस्ट कम हो गए, पेशेंट की सर्जरी अवॉइड हो पा रही है, वो एक बेस्ट पॉइंट हो गया। अगर पेशेंट की सर्जरी लग रही है, लाइक इफ द पेशेंट इज गोइंग टू नीड अ सर्जरी बट एग रिजर्व कम हो सकता है, तो ये 2017 से मैं बात बोल रही हूँ। 2022 में इशरे, यूरोपियन सोसाइटी ऑफ ह्यूमन रिप्रोडक्शन, इसके गाइडलाइंस आए। जब एंडोमेट्रियोसिस में ये बोला गया, तब तक हम हमारे क्लिनिकल लॉजिक, जैसे मैं गवर्नमेंट मेडिकल कॉलेज से टीचिंग कर चुकी हूँ और मैं बहुत सालों से आईवीएफ कर रही हूँ, तो लॉजिकली हमें ये दिखता था कि ओवरी में सिस्ट है, बट सिस्ट ओवरी के अंदर है और काफ़ी सारे एग साइड में हैं और पेशेंट अभी फर्टिलिटी प्लान कर सकती है। तो सर्जरी से पहले, क्योंकि सर्जरी में एग का काफ़ी टिश्यू चला जाएगा, तो सर्जरी से पहले एग फ्रीज करो या एम्ब्रियो फ्रीज करो। देन स्टिल आप देखो कि बिना सर्जरी के पेशेंट को अगर आप प्रेग्नेंट कर सकते हो तो मेडिकली एंडोमेट्रियोसिस को डाउन रेगुलेट करो और फिर एम्ब्रियो ट्रांसफ़र करके प्रेगनेंसी करो। या पेशेंट इमीडिएटली प्रेगनेंसी नहीं करना चाहती तो आप एम्ब्रियो फ्रीज रखो। ट्राई टू कंट्रोल द डिसीज एज लॉन्ग यू कैन कंट्रोल। अगर वो कंट्रोलेबल नहीं है तो सर्जरी करके अगेन आप उसे मेडिकली कंट्रोल में रखो। So the commitment of the doctor to an endometriosis patient has to go years together. Like जैसे मैंने अभी आपको बोला कि पेशेंट्स के एंडोमेट्रियोसिस की केसेस है जो 2017 में ये केसेस होते थे कि दे एग्स कम होने की वजह से वो आईवी फेल हो रहे हैं उनके। तो दैट टाइम आई हैड डन दिस सैंडविच थेरेपी। हाउ दिस डन? व्हेन यू हैव एग्स और एंडोमेट्रियोसिस है, पहले अगर एग रिट्रीव कर पा रहे हो तो आप पहले एग रिट्रीव करके एम्ब्रियो बना के रखो। अगर आपके पेशेंट का यूटरस ठीक दिख रहा है तो आप एम्ब्रियो ट्रांसफ़र करो। बट अगर पेशेंट का एंडोमेट्रियोसिस स्ट्रक्चरली ज़्यादा है, एंडोमेट्रियोसिस की वजह से इम्प्लांटेशन रेट कम हो सकते हैं, तो एम्ब्रियो हमारे पास फ्रोजन है, आप लैप्रोस्कोपी करके जो भी स्ट्रक्चरल, बिकॉज लैप्रोस्कोपी से आपका एंडोमेट्रियोसिस का जो लोड है वो काफ़ी कम हो जाएगा। वो कम है तब आप उसको प्रेगनेंसी इम्प्लांट कर सकते हो ताकि आपका पर्पस सॉल्व हो जाए। सर्जरी करने के बाद विद इन नेक्स्ट 3 to 4 months आपका एंडोमेट्रियोसिस बहुत ज़्यादा कम हुआ होता है, तब आपके इम्प्लांटेशन रेट ज़्यादा अच्छे आएंगे, प्रोवाइडेड आपके हाथ में एम्ब्रियो रेडी है।
राइट, क्योंकि आपने वो पहले रिट्रीव कर लिया
करेक्ट।
है।
हमने अगर पहले सर्जरी किया हुआ है या फिर हमारे पास आईवीएफ का फैसिलिटी नहीं है और हमने सिर्फ सर्जरी किया हुआ है, तो फिर उसके बाद एग रिट्रीवल में एम्ब्रियो मिलेंगे या नहीं। तो ये जो सैंडविच थेरेपी है, ये जैसे मैंने बताया, इट हैज़ बीन गिवन एज अ गाइडलाइन बाय इशरे इन 2022 कि आप ये तरीके से एंडोमेट्रियोसिस को मैनेज कर सकते हो।
आपने बोला कि एंडोमेट्रियोसिस में लेट्स से यू फाउंड कि वन पर्सन, द वुमन इज सफरिंग, है ना? लेकिन अगर उनके एग्स आपको दिख रहे हैं तो यू रेकमेंड दैट दे शुड गेट प्रेग्नेंट। इन दैट केसेस आर देयर एनी प्रिकॉशंस या ऐसा कुछ है कि इट विल अफेक्ट द मदर और द चाइल्ड मूविंग ऑन, बिकॉज शी इज क्लियरली सफरिंग फ्रॉम एंडोमेट्रियोसिस विच एवर स्टेज, है ना? लेकिन वो दिख रहा है कि है, सिस्ट है, लेकिन इन दैट केस इफ समवन गेट्स प्रेग्नेंट, विल इट अफेक्ट?
See, I had a very renowned nephrologist family. She came from Canada with a bilateral ovarian cyst, both ovaries. And the concerns were the same. Her AMH was good, and there was small cyst, 4 centimeters both side. Now, because her egg quality was good, when you get pregnant with all these therapies, 9 months you're not getting periods. So that lady, we did her IVF, but because the disease was only in the ovaries. In fact, because of pregnancy, your question is like that if there will be any side effect to body. So when we logically explain it and scientifically prove it, then it becomes easy. So for this lady, when we did her embryo transfer, 9 months the pregnancy grew because there was no period. At the time of delivery, she delivered healthy twins, but there was no endometriomas both sides. And I got a call from the doctor from Canada that the endometriosis has regressed a lot. And this will be agreed by every fertility doctor that when patient is pregnant, the endometriosis gets down regulated because there is no menstrual cycle going. Why endometriosis is increasing? Because every month you're ovulating, estrogen is pushing, hormones are pushing your endometriosis. That's where the cysts are coming.
Right.
So,
Just
the right context.
just question, right? Have you seen these endometriosis, PCOS, for a woman who has children of her own, let's say in her late 30s or something?
Yes,
Is it
yes.
common?
In fact, endometriosis keeps on coming after, even after delivery for few years, you will
It
have
does.
reduction,
Okay.
but again it can come. So, one patient who had 13 years of fertility treatments, because of endometriosis, the implantations were not happening. Now, she got pregnant at 40s. She delivered a baby, but after that, by 43, 44, she had again pain recurrence. She had endometriosis, which was again coming back. But her baby is done. So endometriosis can come back. But there are solutions like Mirena, intrauterine devices, which can avoid your hysterectomy.
Okay.
Because patients with endometriosis at later age can undergo hysterectomy.
Yeah.
So now the things are improved, and with LNG IUS, that is called Mirena, we can prevent the endometriosis progress because endometriosis have only two problems actually: pain and infertility. पेन इज अ प्रॉब्लम एंड इनएबिलिटी टू हैव बेबी, बट बेबी नहीं हो रहा है या पेन ज़्यादा हो रहा है। ये दोनों कंसर्न को उनके एज के अकॉर्डिंगली कवर करना है। जैसे मैंने प्रोटोकॉल्स बताए कि अगर किसी को फर्टिलिटी चाहिए तो उसके प्रोटोकॉल्स कैसे करने चाहिए, बेबी होने के बाद अब पेन नहीं बढ़ना चाहिए बट उसके प्रोटोकॉल्स अलग है। सो एंडोमेट्रियोसिस हम कंट्रोल कर सकते हैं।
पीसीओडी के टाइम पे टू रेगुलराइज आवर पीरियड्स, ये पिल्स लेने चाहिए?
पीसीओडी में क्या होता है, पीरियड लेट आ रहे हैं। क्यों आ रहे हैं? बिकॉज ओव्यूलेशन नहीं हो रहा है। अब अगर हम पिल्स लेके पीरियड रेगुलर कर रहे हैं, अब इसका बहुत सारा कंट्रोवर्सी, लॉट ऑफ गर्ल्स बहुत सारे टाइम से 2-2 साल से पिल्स ले रहे हैं कि उन्हें लग रहा है पिल्स से तो पीरियड रेगुलर हो रहे हैं। सी वन थिंग इज पीसीओडी में ऑलरेडी हाई हार्मोन्स हैं। अब कोई डाउट नहीं है इसमें कि इतने हाई हार्मोन से ईस्ट्रोजन के साथ ओव्यूलेशन नहीं हो रहा है, इसके लिए पीरियड नहीं आ रहा। करेक्ट। अब अगर आप इस्ट्रोजन प्रोजेस्टेरॉन के टैबलेट कंटिन्यूअसली लेते रहोगे तो पीसीओडी का बेसिक प्रॉब्लम क्या है? वेट गेन, आपका मेटाबॉलिज्म ठीक नहीं है। तो आप अगर कंटिन्यू ईस्ट्रोजन प्रोजेस्टेरॉन कंटेनिंग पिल्स अगर कंटिन्यू पॉप करते रहोगे एवरी मंथ 1 और 2 साइकिल्स, नो प्रॉब्लम टू जस्ट टू रेगुलराइज सिस्ट कम करने के लिए। लेकिन कंटिन्यू लॉन्ग टर्म एक्सपोजर, ये सब पिल्स को लिवर मेटाबोलाइज करता है, करेक्ट? तो लिवर पे ये उसकी वजह से फैटी लिवर, मेटाबॉलिक प्रॉब्लम्स, रिबाउंड वेट गेन, ये प्रॉब्लम ज़्यादा होंगे। तो आप सोचोगे कि अभी पीरियड रेगुलर करने के लिए पिल्स भी नहीं ले सकते, तो पीरियड लाएंगे कैसे? करेक्ट? तो हमें पीरियड लाने के लिए ना चाहिए सिर्फ एक प्रोजेस्टेरॉन, ठीक है? तो अगर मैं हमेशा पेशेंट होते थे, आप हर महीने मेरे पास आओगे सेम डे, और पीसीओडी के पेशेंट बहुत सारे डॉक्टर्स चेंज करते रहते हैं क्योंकि उन्हें लगता है कि कोई मेडिसिन लेंगे जिससे पीरियड परमानेंटली रेगुलर हो जाएंगे। नो, पीसीओडी यानी पीएमओएस, वी आर नाउ चेंजिंग द टर्म। तो पीएमओएस के जैसे टाइप्स होते हैं वैसे हम पीरियड रेगुलर करने के भी तरीके बताते हैं, एंड हम 6 मंथ्स टू 1 ईयर पेशेंट को फॉलोअप के लिए बताते हैं। तो जिसको सपोज पीरियड 2 मंथ्स 3 मंथ्स में आ रहे हैं या फिर टैबलेट लिए बिना नहीं आ रहे, उन्हें क्या करना है? बहुत देर तक पीरियड नहीं आया तो क्या होगा? यूट्रस के अंदर एंडोमेट्रियम थिकनेस बढ़ जाएगा। तो जब पीरियड आएगा तो बहुत हैवी फ्लो जाएगा, तकलीफ होगी, या फिर एंडोमेट्रियम थिकनेस बढ़ने की वजह से पॉलिप्स बन सकते हैं। तो गर्ल्स को पहले हम पीसीओडी करेक्ट पीएमएस करेक्शन के मेथड्स बताते हैं, डाइट, एक्सरसाइज, एवरीथिंग, सप्लीमेंट्स, क्या मेडिकेशन लेना है, उसका एक प्रोटोकॉल बनाते हैं। साथ में एक सिंपल चीज़ हम बताते हैं कि आपका पीरियड अगर 50 डेज के ऊपर चला गया है, कि अपने आप पीरियड 30 डेज में आना चाहिए, 50 डेज 55 डेज, आप अपना एक थ्रेशोल्ड पकड़, उसके बाद आप सिंपल प्रोजेस्टेरॉन का 5 डेज का टैबलेट लो। उससे क्या होगा? आपको कंटिन्यू हार्मोनल एक्सपोजर नहीं रहेगा, और आपके टैबलेट खत्म होने के बाद आपको पीरियड आ जाएगा, विच विल बी जस्ट अ विड्रॉल ब्लीडिंग। यू आर नॉट पॉपिंग द मेडिकेशन ऑन योर बॉडी अगेन एंड अगेन। और आपका कंसिस्टेंट डाइट लाइफस्टाइल कंटिन्यू रखो ताकि आपका पीएमओएस कंट्रोल में रहे।
व्हाट इज नॉर्मल साइकिल? आपने बोला कि रेगुलर साइकिल, राइट? किसी को 3 दिन होता है, किसी को 5, 7, 10, हैव सीन 10 days ऑल्सो।
साइकिल के
रेगुलर क्या
तीन
है?
चार एस्पेक्ट होते हैं। एक पहला एस्पेक्ट है कि कितने दिनों में पीरियड आना चाहिए, जैसे
हाँ।
रेगुलरिटी, कितने दिन फ्लो होना चाहिए, फिर पेन कितना होना चाहिए, ब्लड लॉस कितना होना चाहिए। सो पहला तो दिन हम बता, तो जो गॉड का साइकिल है वो है कि हर बॉडी, हर पर्सन का अपना अपना एक फिजियोलॉजी है। तो कोई गर्ल को हर 21 डेज में पीरियड आता है, जैसे बोलते महीने में 2 बार आता है, लेकिन गैप बिटवीन फर्स्ट डे टू नेक्स्ट फर्स्ट डे इज 21 दिन, हमेशा 21 दिन में पीरियड आता है, वो रेगुलर है। उनका फिजियोलॉजी थोड़ा फास्ट है, उनका ओव्यूलेशन जल्दी होता है, उनको एग रिजर्व थोड़ा जल्दी खत्म हो सकता है। लेकिन 21 डेज, किसी किसी 35 डेज का साइकिल है, जैसे हर 35 डेज में पीरियड आता है,
हम्म।
दैट इज ऑल्सो ओके। एनीथिंग लेस देन 21 डेज से जल्दी आना, एनीथिंग मोर देन 35 डेज से लेट हो जाना, इसे हम इरेगुलर पीरियड बोलते हैं। जो आपकी बॉडी का साइकिल रिदम सेट है उसे आप ट्रैक करते रहिए, रेगुलरिटी उसी को कहते हैं। नॉर्मली 28 to 30 डेज ये एवरेजली मोर मैक्सिमम पॉपुलेशन का पीरियड का डेट होता है।
सो बहुत सारी यंग गर्ल्स हु आर इन्वॉल्व विद देयर पार्टनर्स वेरी अर्ली ऑन, दे आर सो पेट्रिफाइड कि कब जाना चाहिए गायनेक के पास। 1 महीने पीरियड्स नहीं आ रहे, 35 days, 40 days, एट व्हाट पॉइंट डू आई गो एंड कंसल्ट अ डॉक्टर सेइंग इज देयर
सी,
समथिंग रॉन्ग?
कॉन्ट्रासेप्शन, ये कॉन्ट्रासेप्शन के लेवल पे ही करेक्ट हो तो ज़्यादा अच्छा है। सपोज यू आर सेइंग दैट कि लॉट ऑफ यंग पीपल आर हैविंग, दे आर एक्टिव, सेक्सुअली
Yes.
एक्टिव, एंड दे वांट टू प्रिवेंट प्रेगनेंसी। द बेस्ट थिंग इज टू हैविंग दैट अवेयरनेस to avoid the pregnancy, having barrier contraception, knowing the dates, knowing their cycle. Okay, if they have short cycle, so they should have abstinence during the ovulation time, not because like it's a order by me, but these are the ways to prevent unwanted pregnancies. But if somebody has a regular cycle of suppose 25 days, and if they are getting delayed by 28 days, what are the most common reasons why young sexually active women will miss the period? Reproductive age. First thing is pregnancy, most common. But there are other reasons also why somebody can miss the period. There can be infection, white discharge. Because of that, also sometimes periods get delayed. So if the period is getting delayed and somebody is expecting that they can be pregnant, as soon as they miss the period, they should do the pregnancy test. Right? But having the precaution, right? Understanding about what we are seeing is very important.
राइट सो ये जो केसेस होते हैं जहाँ उन्होंने ये कॉन्ट्रसेप्शन लिया है, डज इट इम्पैक्ट आगे जाके on pregnancy and fertility? What I mean was women taking pills, right? Contraceptives.
Yes. So contraceptive pills have been there since ages. Somebody gets recently married, they don't want a baby, they also get the contraceptive pills. So for contraception, suppose somebody is taken 5 to 6 months of contraceptive pill, I usually tell to give a break in between. It's not that there is any hard fast rule that you cannot take 2 years of contraceptive pills. But again, as we are talking about PCOD pills, non PCOD pills, so when they are using the contraceptive pill, they are generally considered safe. Contraceptive pills will prevent pregnancy, they have highest success rate. But of course, missing the pill, there are different concept concerns about every contraception.
Right. Right. So just coming back to the whole cases of IVF, right? And ये बहुत सारा myth है कि what you do in your early on shows later in your life. When someone like myself who has thought about, read through and decides कि egg freeze करते हैं या फिर हमें 1 2 3 methods लेने चाहिए, but then you see cases where there are clinics, fertility clinics, where there are embryos which have mixed up. Imagine I am taking everything possible, from a financial perspective, emotional perspective, time perspective, everything, and then there is a clinic who mixes the embryos.
Yes, this is the change, and this is the thing which is we are like witnessing now.
Yeah.
And I'm very glad that you asked me this question. Now, what is important? There are two things. When somebody comes to a fertility doctor, they are trusting the doctor with two things. First is their medical care, and another thing is their future children. So, it is very important to emotionally, mentally understand the process which we are doing, how important it is, and what used to happen as the science progresses, the challenges happen, number of cycles are increasing. So, how the embryo gets mixed up, that has to be understood. So, first thing is when embryos are being made or we preserve the embryos. So only human identification is the first. जैसे हम खुद के आँख से देख रहे हैं, we are reading the patient's name and we are labeling the embryo and we are freezing the embryo. ठीक है, तो ये embryo freezing जो होता है, अब सिर्फ human method से check करना is only one level of checking. So अभी जितना साइंस हर चीज़ में एडवांस हो गया है, तो हमारे पास मल्टी लेयर फुल प्रूफ सिस्टम होना चाहिए एम्ब्रियो लेबलिंग का, मैचिंग का, ताकि एरर्स नहीं हो.
Absolutely. And imagine someone, ये आपने जो processes बताए हैं, technology driven, human driven, and error on either of the side, right? The locus of control for a patient is very little or negligible. मेरा काम ये है कि मैं बेस्ट डॉक्टर, बेस्ट क्लिनिक के पास जाऊं और उनके ऊपर भरोसा करूं कि they will manage, they will ensure everything that happens. Now recent case जो अभी हुआ है, now imagine after learning, after going through that labor pain and everything and realizing that these are not yours, what is the emotional aspect to it? Like, how does one deal with it?
See, emotional aspect, I don't need to actually talk because everybody understands that.
Right.
But important thing I would say that even a taxi driver or a bureaucrat, we have seen every walk of life going for processes. And when we're doing their procedures, okay, that confidence in them that we will not allow the change of the gametes has to be imbibed in them by us by talking directly that look, this is what, and we are going to do yours only. I mean, whatever we are doing, if somebody needs a donor gamete, it has to be explained to the person. And when you actually speak very clearly, that emotional aspect is settled at that point in time only, because person knows that we are already aware and talking about it.
Right.
When you talk about something, what you actually know and think about it, like the patient gets a confidence that doctor has already considered all these things and they are giving us assurance, because that is where today's practices are. Correct. About emotional aspect in fertility, I have had patients who have uh, long years of waiting. Sometimes they had 5 months miscarriages and a lot of emotion. But I have understood, and I've always told my patients that mostly what happens, uh, wife who is all stressed out, not working out, emotionally drained, she's pulling herself, she's going to work, she's putting herself together and coming to the clinic, and husband says, we want success and she's not taking care, she's not
Huh.
working out and she's not doing this. I always tell her, and because see, I can see that genuine fellows, that husbands pure wish that the wife should do good, because that he feels as a team that it will be giving us better success.
Hmm.
But sometimes person is emotionally disturbed.
Hmm.
So what I usually try to tell my patients as a couple, that I understand the intent, but the way of taking, because हम बोलते हैं ना कि if doctor tells a patient, they will listen, but husband tells husband की नहीं सुनेंगे, because it feels like nagging, it feels like annoying. So I always tell, the person has already read, has already heard, already listened from a doctor that lifestyle correction is important. You again telling is not going to be giving any output. And I believe me, a lot of patients do have this mismatch where husband is saying, but I say that put it in the actions rather than trying to push her, take some load off her work, or be a partner to her, do some activities together. Okay, be a nice person to her, and then she will automatically find some time, the person's nervous system resets again, and the person really starts enjoying themselves or making their health better, and then they come to the level where you want them to be in terms of
Right.
diet and exercise.
Have you seen cases जहाँ पर fertility failure हुआ है and suddenly the onus is on just on the woman saying I told her that she should have taken care. Have you seen such cases?
See, as a my practice and as my career has, I've spent my big chunk of life in fertility. फेलियर के बाद किसी चीज का डायसेक्शन वो नहीं हो तो ज्यादा अच्छा है. Why? Because whenever we are going ahead, uh, IVF is a very beautiful science. It's a miracle. It's the best science which has been developed in humankind. Okay. But the use, while using, preparing both husband and wife for as a team discussion, that okay, this is your case, what you need, 4 factors you need for pregnancy, any successful pregnancy, what you need, your body has to be in good rhythm, because the person is going to carry, her health is going to be important. So her health, body means what? Thyroid, sugar, metabolism, hormones, anxiety, stress, everything should be comfortable. I don't say it should be this only, because somebody is 100 kg but their metabolism is okay. I'm not going to tell, oh, you are 100 kg, that's why you didn't get result. That's very hurtful of doctor to say to somebody. So if the metabolism is okay, you understand? You have seen a lot of women even with higher.
Yeah.
So it is body axis. Somebody is 50 kg, her periods are regular. That person becomes 70, her periods become irregular. So you have to tell your axis is not correct. So first, body. When the body is in right rhythm, try to get as best as it can get. Tell your patient that this is the contribution I need from you. Okay. People are very sincere. Once they see that you're sincere, they are very sincere. Then what? Body, then you need uterus. So in uterus, sometimes there are endometriosis, there are fibroids. So there are some cases which you need not operate, some cases we need to operate. That has to be mapped with a 3D and showed to the patient that this does not need to be surgery. There is a fibroid, but it's outside. You don't need to operate it. So you're giving information, you're giving opinion also. Then after uterus, sometimes in uterus there are infections, white discharge. Simple probiotics, okay, that corrects the hormonal milieu. The endometrium has to be healthy. Then third thing is embryos. The egg and the sperm has to be in the right condition. Whether it is naturally coming or you're doing an IVF is a matter of scientific assistance. Okay. But for a pregnancy, you need all this. And there are a lot of things which are correctable. Correct.
Right.
We have already discussed about how the embryo is to be formed according to the egg reserve. We're freezing the eggs or we're making the embryo. PMS you are correcting, endometriosis you are correcting, you are using different protocols, but that comes to embryo formation. And last thing is important is doctor and doctor patient relationship. So when we have done the right attempt, okay, even the failure is taken in a understanded way, and the patient and the team as patient and doctor, they know that we have worked together, what can be corrected. See, if you do same thing again and again, you will get same result.
Right.
So I always talk to my patient, if you've done something, if you're not getting success, try to see what can be changed. Whether, like, it is, suppose somebody has done um, hormone replacement therapy like frozen embryo transfer, HRT protocol, estrogen tablet. So try to do a modified natural protocol. So change the protocol. You can see some difference because everybody body is working in a different rhythm, and that picking up and personal attention will reduce the number of attempts.
Right. But we're only human, right? We place a
Correct.
lot of expectations and hope on this entire process. If someone goes through it, and I'm sure there have been cases where you have to go through this process over and over again, try different methods, try different mechanism, but every single time it's a hope. We're only human. So
Right.
how does one deal with it? Do you see women, men, both, like, in a couple setting, both of them feeling the same thing, or one is high, or how does it?
हमारी पेशेंट में ना पर्सनालिटीज काफ़ी चेंज होती है लाइक
Hmm.
एवरी पर्सन इज डिफरेंट सम पीपल आर टाइप ए पर्सनालिटी वेरी aggressive, very like oriented. Some people are type B personality, they're comfortable. Now everybody's way of handling the stress is different. You understand? So when we are developing a team, I'm doing a person's IVF, see, we have to understand right time of the IVF is very important. So I never start like, you do the IVF immediately. I first want the person to understand the whole process, whether it takes 1 month, 2 visits, 3 visits. Understand the whole process. Walk through it. Okay. Once you walk through it, then you know that you are going to do this, this, and this is how we are going to achieve the result. So, and if I see the couple is, whenever somebody is sitting in front of me, we usually try to understand how emotional disturbances are there. Like today itself, I spoke to a person, and this is actual today's situation. Person has worked in US for 8 to 10 years, very highly intellectual, and they have now come back because his father suffered pancreatic CA. Then his illness and everything, he left the job. He came here. Okay. And small things were causing him stress. Now this was my third meeting with them. And we were contemplating why he's 38. Okay. So they're like, can we do IUI? Can we do this? I said, see, there are checklists, right? So if you are 9, 10 years married, accidental pregnancy never happened. So there can be something which is not causing you get pregnant. Now at this point in time, I can do your IUI, but I see you stressed and anxious. So your anxiety will make me, I'm figuring out that this is a weak point.
Hmm.
So first understand what will happen. So then we made them walk through the situations where the patient will have undergone, like, 36-year age. They've undergone an mm, process before, IUI, IVF. Now, how we approach it. So, by the end of the discussion, I told him only one thing, that whenever I'm treating you, okay, I do not want to hurt any soul. If I'm telling you, you need to do this, okay, that means I have already made sure that if natural pregnancy is possible or not, unindicated procedure will not be done. And that is sometimes you have to explicitly say to the person, because people have that stress nowadays, which was not there 15 years back. People used to have 10 years of infertility. They used to come, they knew that they need IVF. Nowadays, there is a stress that whether we are doing process, we can conceive naturally, still we are doing it.
Right.
Correct.
Do you think?
So,
Uh,
so preparation, anxiety, stress, it's seen.
hmm.
That's what I'm trying to tell. we can see the couple attention. And if I see couple is very well sorted and they're not having any emotional stress, there are a lot of doctors I treat. A lot of doctors babies have done. But they know, I tell this is the diagnosis, this is the treatment. That has given very smooth. But sometimes if I see as a team, every couple is different. So as a team, if I see somebody is stressed, we have to first walk them through so that they emotionally, mentally get ready for the process. And then there comes the right process.
What about the ones जिनका process fail हुआ है? How is the dynamic after the failure?
That's what. So it has been very long years of handling these situations. So first, I would say every fertility doctor when we are starting. So suppose 2012, 13, if somebody has not got result, we had that. Oh, shall we go ahead immediately next month, next cycle? We have frozen embryos. Now after so many years of work, I feel that oh, I did correctly. I am doing so many years. We did correctly. Let's see why things are not there, and we do some extra test. Sometimes we change the protocols, okay, or do some extra test, and then we go for the next attempt. And if we're approaching that way, and we know when to stop, it's not going to be forever.
Hmm.
So that way patients are more prepared, because as I told you, that if we have known that this is the step we are doing, don't oversell. Don't say rosy picture, oh you will get, there's very good chance. You have to tell, if not this way, this might be the problem. Then the person is mentally prepared. That's where the hope loss and emotional stress comes, because the preparation of positive and negative has not happened before.
Uh, you just mentioned कि 10-15 साल पहले things were little different. Now when patients come to you, do you think वो चैट जीपीटी से पढ़कर आते हैं कि ये प्रोज हैं, ये कौन से आपने ये
ये
सोचा
बहुत
है?
अच्छा
Have you
है,
seen that?
ये बहुत अच्छा है।
हाँ?
बिकॉज़ अगर पेशेंट पढ़ के आते हैं ना,
हम्म,
तो ये एक्सप्लेन करना बहुत ईज़ी हो जाता है।
हम्म,
मैं आपको एग्ज़ाम्पल देती हूँ। आई पेशेंट शी हैड ऑलरेडी नोन दैट शी इज़ PMS, like
हम्म,
PCOD patient. Now, she always thought she has PCOD. He had hair loss, little weight and everything. But when I saw her, her AMH was only 2. The AMH is not very low, but it is not in the PCOD range. And she has done multiple cycles, so she came in for IVF. Now she read in ChatGPT that frozen embryo transfer is very good. Correct. So I said, yeah, it is good, but let me explain you. See, I didn't feel bad about her questions, because that is what we want. If patients are having knowledge, it is easier to explain. So it's nothing wrong in that. So I told her that your AMH is 2, your endometrium with the stimulation, when we are giving egg stimulation, your endometrium is developing good. You don't need to take the hormone replacement therapy for embryo transfer. So then she said, why ChatGPT is telling that frozen embryo transfer is good? Right? So I told her, like when patients of PCOD or in olden time, 2010, 11, people, women used to have 15, 20 eggs, suppose somebody has PCOD and they are doing IVF. So with a high hormone, if they go for fresh embryo transfer, their pregnancy positivity will reduce because of high hormone. Or if they get pregnant, they are having risk of hyperstimulation because the hormones are high. And that's where that time freezing was not that great, so people used to have that stress. The moment freezing became good, your 100% survival of the embryos, then the easy thing was what? Make the embryo, freeze the embryo, wait for the hormones to come normal, and then go for a natural cycle embryo transfer or a HRT cycle embryo transfer. So that's where OHSS was the major risk of IVF, which has been taken care by freezing. That's why freezing is giving good results. Right. Correct. But if you apply the same protocol to everybody, a lot of women have to go for HRT based hormone replacement therapy, frozen embryo transfer. If their AMH is 2, they're having 7, 8 follicles. They are not having high risk of OHS that I have to see. I discuss with her that I need your support. That if your hormones are not very high, we will do a fresh embryo transfer. Surplus embryo will always be frozen. It is not that we don't have the facility. We have the facility, but the main thing is about protocol formation for the doctor. And that is where the patient was very happy. She understood that ChatGPT is giving one information. I now have to go and read the studies. I told her, you read between low AMH or normal responders, see the results. Then she said, I am very happy. You have explained me. I would go for fresh embryo transfer. No problem at all. So that is where, as a team, the person nowadays women are very much understanding if we're talking about this, because they are all beautiful set of generation. This is
Thanks. I'll take it for everyone.
yes.
So, egg freezing का the whole aspect, right, from start to end, usually कितने years तक आपने देखा है कि हाँ, इतना मतलब someone has kept freeze their eggs for 4, 5, 7 years. What's an ideal timeline?
Uh, See, freezing is like once you freeze
Hmm.
the embryo or egg, it is frozen at sub-zero temperature. Once the gamete is frozen, unless you take it out and thaw, that's a process of taking out the defreezing.
Hmm.
Till that time, it remains the same. So I have seen till like almost 10 years of gap also, that somebody has frozen the eggs and the embryos. Okay. Child is now like 10 years. Now they come for the second baby and they have got the pregnancy on the same embryos.
Oh, that's very interesting. So I'm sure आपके बहुत अच्छे cases भी होते होंगे, someone who has gotten hope, someone who's happier. Can you share some stories with us?
Yeah. So in my long years of work, I would want to share one story wherein it is more of information or understanding. There was it's a recent case. She had undergone two IVF cycles before. And we are always talking about IVF process, success, failure. But this lady had two pregnancies. But she had, because of blood flow problems to the uterus, she had lost the pregnancies at 6 to 7 months. So she was petrified. When we started her treatment, we started with correction. We did IVF, it got successful, but we knew that her performance at, and this is where people refer that, if you have high risk pregnancy, do come, like do see this doctor. That's where I told her, I'm not God, but I will give you the best possible. So we increased her doses of blood thinners. We kept on monitoring. She was prepared from 26 27 weeks that there can be, we can pull it till 31 weeks or 32 weeks. But with the medication, with the higher doses, she continued her pregnancy. So 31 week, we were trying to deliver. We will try to see her, but it was all okay. So we decided to continue till 34 weeks. At 34 weeks also, the Liker volume was maintained with the blood thinners and protein injections. Then at 35 to 36 weeks, we had to take a call for her delivery. And that is where the healthy baby was born. So these stories tell us that being a gynecologist, we have worked from government medical colleges. We all have done all obstetric work, high risk work. And after that, there comes a super specialty of IVF. So having the strong base and then doing super specialty work gives us a lot of control and positive outlook to getting the patients out of the danger zone.
कितना important है nutrition for both, in this situation, pre-IVF, during and after?
So, nutrition is a lot about metabolism of a person. It's not that, I will tell you simple. A lot of patients ask me, Doctor, should I eat this for getting early pregnancy? Should I eat that to getting early pregnancy? Or is veg is okay, non veg is okay? Right? I'll tell you simple. Babies are born across the world in big cities or small villages, in China, US, or India. So, then what is the diet actually important about? Correct. So, having this understanding, what you have to understand is what is good for your metabolism. Like a lot of patients, they try to stick to certain diet, okay, and reduce the intake of other things. So, the diet has to be holistic, it has to be moderate. यानी क्या? Holistic, moderate, ये तो words है. हमारा ये है कि this is my own very strong belief system, and I will try to explain you. What you have to do is you have to see that how is your gut metabolism. लाइक अगर आपको गैसेस ज़्यादा हो रही हैं, आपको एसिडिटी ज़्यादा हो रही है, आपको बार बार एंटासिड लेने की ज़रूरत पड़ रही है, आपको ज़्यादा गैसेस होना, ज़्यादा लूज मोशन, कॉन्स्टिपेशन, इसका मतलब आपका गट ठीक नहीं है। और गट इश्यूज़ की वजह से अभी थियोरीज है कि एंडोमेट्रियोसिस और पीसीओडी भी गट इश्यूज़ की वजह से ज़्यादा होता है। तो न्यूट्रिशन लेवल्स ये पर्सन को हमें क्या सूट हो रहा है, जैसे कुछ लेडीज़ को ज़्यादा एक साथ बहुत ज़्यादा खाना नहीं खाना चाहिए, बट जैसे एक मॉर्निंग में फ्रूट्स, सो मेरा एक सिंपल एडवाइस होता है लेडीज़ को, 3 टाइप के फ्रूट्स और 3 टाइप के ड्राई फ्रूट्स आप मॉर्निंग और इवनिंग में डिवाइड करो। लंच और डिनर में आप ये फ्रूट्स और ड्राई फ्रूट्स मत लो। और ये और सबसे बड़ा इम्पोर्टेंट प्रॉब्लम पीसीओडी के पेशेंट्स का है ब्रेकफास्ट स्किप करना। तो ब्रेकफास्ट स्किप नहीं करना चाहिए। और ब्रेकफास्ट में न्यूट्रिशियस गुड प्रोटीन इनटेक, आप वेज खाते हो नॉन वेज खाते हो, नॉट अ प्रॉब्लम। साथ में आपको रोज एक ही फ्रूट नहीं खाना है, आपको फ्रूट चेंज करते रहना है। क्या है, मिनरल आपकी बॉडी में अच्छा रहेगा। लॉट ऑफ गर्ल्स आर नॉट ईटिंग फ्रूट्स फ्रॉम चाइल्डहुड। नाउ यंग एज दे से डॉक्टर मुझे फ्रूट्स देखा तो उल्टी आती है। This is the I understand that ki the person has not been trained from childhood. Now it is little more difficult. So बचपन से ही आपके घर के बच्चों को भी आप ये आदतें डालना शुरू करो, यहाँ से चेंज होता है। बिकॉज सडनली हम आईवीएफ के लिए जा रहे हैं इसलिए हम डाइट चेंज करें, इज नॉट अबाउट इट, इट्स अबाउट योर लाइफ एंड हेल्थ। वो तो वो तो आपका अच्छा होना ही चाहिए। करेक्ट। अब आता है, जब प्रेगनेंसी हम प्लान कर रहे हैं तो फोलेट रिच डाइट होना चाहिए, प्रीनेटल फॉलिक एसिड आपको लेना चाहिए, आपका B12 विटामिन डी लेवल्स चेक करना चाहिए, न्यूट्रिशनल अगर आपको मेटाबॉलिक इश्यूज है तो प्रोबायोटिक्स का ऐड करना चाहिए। और साथ में जो हमारा एज ओल्ड विजडम है कि लंच और डिनर में मिलेट्स ऐड कर सकते हैं आप, दही छाछ, ये नेचुरल प्रोबायोटिक्स हैं। और आप बैलेंस्ड डाइट लीजिए, कोई कीटो, और ये ऐसा ज़रूरी नहीं कि कीटो इज़ बैड। मेरा ऐसा कहना नहीं है कि intermittent fasting is bad. Nothing is bad. The person who is following that needs to see the benefits in their body, if it is working out for them or not. Okay. And the person who is not doing anything, I would just say stick to the basics. Morning breakfast miss mat karo, or workout.
This is
And
very
it's
interesting
very
because there's a lot of
important.
superstition around it, हाँ, workout during pregnancy and कब stop करना चाहिए, कौन से तरीके के workouts करने चाहिए.
Yes. So मैं पहले भी बोलती थी कि अगर सपोज किसी का बहुत पहले वर्कआउट इन प्रेगनेंसी कहाँ से शुरू हुआ, लारा दत्ता के वीडियोस आते थे।
Really?
लारा दत्ता ये पहले से वर्कआउट करती थी,
Hmm.
और वो जब प्रेग्नेंट हुए तो उन्होंने प्रेगनेंसी में भी वर्कआउट कंटिन्यू रखा, एंड देन शी रिलीज्ड वीडियोस, दैट्स वेयर द पीपल गॉट अवेयरनेस। ओ ड्यूरिंग प्रेगनेंसी आल्सो वर्कआउट कर सकते हैं, नहीं तो दैट वाज अ नोशन दैट कि प्रेगनेंसी है तो हिलो ही नहीं,
हाँ, हाँ.
राइट, कुछ भी मत करो। सो नाउ somebody asked me what exercise I should do in pregnancy. I first tell that what exercise you were doing before getting pregnant. Correct. So whatever you were doing, try to reduce it to 50%. So you see a lot of videos of women lifting weight during pregnancy. See, that is not that everybody has to start doing that. They are telling that suppose you were a weightlifter before pregnancy, you need to do these modifications after pregnancy. So usually tell my pregnant patient, don't start training for a new exercise because your muscles have not got trained for it. Okay. So if somebody is doing some exercises, reduce it to 50%. According to pregnancy, make sure that the baby is safe and there are no complications. Get your gynecological checkup done, obstetric checkup done. And if somebody has never done exercise during pregnancy, start with breathing exercises, pranayam, start with stretches, start slowly, and then see how much your body can take. Okay, routine walks during pregnancy, as long as there is no obstetric indication, obstetrically, like your doctor has told not to walk. Apart from that, routine activities are allowed during pregnancy, which are good for your metabolism.
Yeah, and they should. It's also about mental health, right? If you suddenly change the way you've lived your life, it would definitely have some of the other impact.
Correct.
आपके पास इतने सारे केसेस आते हैं, आपके पास ऐसे केस आए हैं क्या जहाँ पर हस्बैंड्स हैव कम एंड दे थिंक कि सब कुछ बढ़िया है एकदम, ठीक है, लेकिन यू रियलाइज कि सीमन है लेकिन स्पर्म काउंट नहीं है, ऐसे केसेस आते हैं?
काफ़ी बार ऐसे होता है कि स्पर्म डिस्चार्ज को मैन इक्वेट कि वॉल्यूम अच्छा है तो काउंट रहेगा ही। आई समटाइम्स मैन से आई डोंट हैव एनी सेक्सुअल प्रॉब्लम, आई एम परफेक्टली फाइन। बट ये दो चीज़ें अलग हैं। स्पर्म जो सीमेन आता है उसमें काफ़ी फ्लूइड्स रहते हैं, बट उसके साथ उसमें स्पर्म्स का होना ज़रूरी है। तो जब हम स्पर्म एनालिसिस करते हैं, ऐसे केसेस हुए हैं कि जहाँ पे स्पर्म काउंट बहुत लो या कभी-कभी ज़ीरो पाया जाता है। अब स्पर्म काउंट ज़ीरो है तो ये बहुत इमोशनली साइकोलॉजिकली ट्रॉमेटिक होता है। हमें इसे स्ट्रेस नहीं देना चाहिए। कभी-कभी स्पर्म काउंट ज़ीरो होता है बिकॉज़ टेक्नीक प्रॉपर नहीं है या फिर प्रॉपर सैंपल नहीं दिया गया। तो कभी भी किसी को ये बोलने से पहले कि आपका स्पर्म काउंट नहीं है, पहले हमें 2 बार उसे चेक करना चाहिए। और जब ये सब रूल आउट किया और प्रॉपरली हमने चेक किया और फिर भी अगर हमें स्पर्म नहीं मिल रहे हैं, तो उसे हम एज़ोस्पर्मिया बोलते हैं। एज़ोस्पर्मिया में स्पर्म नहीं है तो उसे पहले जब हम पेशेंट को काउंसल करते हैं, तो ये ऐसा नहीं होता है कि आपके स्पर्म नहीं है। नो, राइट नाउ काउंट नहीं है। इमीडिएटली हमें बिकॉज़ लॉट ऑफ इमोशनल एस्पेक्ट उसमें जुड़ जाता है कि बहुत सारे नेगेटिव थॉट्स आने लगते हैं। तो तभी ये बताना है कि स्पर्म नहीं है। इसका मतलब क्या है? ये ऑब्स्ट्रक्टिव एज़ोस्पर्मिया हो सकता है जिसमें स्पर्म बन रहे हैं लेकिन बाहर नहीं आ रहे हैं, या फिर नॉन ऑब्स्ट्रक्टिव हो सकता है जिसमें स्पर्म बन रहा है बट बहुत कम मात्रा में या फिर नहीं बन रहे हैं। इसकी वजह से वो इजैकुलेट तक नहीं आ रहा है। अब ये पता करने के भी कुछ सिंपल टेस्ट होते हैं। सोनोग्राफी होता है जिसमें टेस्टिकल का साइज़ देखा जाता है, एक आध एफएसएच हार्मोन देखा जाता है जिसमें हमें पता चलता है कि टेस्टिकल का वॉल्यूम ठीक है, पॉसिबिलिटी ऑफ स्पर्म्स इज़ देयर। और एक प्रोसेस होता है जिसे हम टेसे टेस्टिकुलर स्पर्म एक्सट्रैक्शन और माइक्रोटेसे, जिसे माइक्रोस्कोप के अंदर अच्छे हेल्दी ट्यूब्यूल देख के उसमें से स्पर्म एक्सट्रैक्ट करके हम वो स्पर्म से इक्सी इंट्रासाइटोप्लाज्मिक स्पर्म इंजेक्शन से बच्चा बना सकते हैं। तो जब ये सब स्टेप्स एक साथ बताए जाते हैं तो पर्सन को अंडरस्टैंडिंग आता है। अब हम टेसे करने जाएंगे किसी का, तो उससे पहले हमारा वापस ये आता है कि 3 मंथ्स का स्पर्म का लाइफ साइकिल है। तो आज हमें स्पर्म नहीं दिख रहे हैं, हम कल टेसे करेंगे। बट टेसे में स्पर्मेटोजेनेसिस यानी स्पर्म बनने की मात्रा बहुत कम है और बहुत छोटे-छोटे पैचेस में स्पर्म बन रहे हैं कहीं पे। तो आपका पहला अप्रोच क्या होना चाहिए? आप ऐसे मेडिकेशन दो, एंटीऑक्सीडेंट्स, मेडिसिन, ये इंजन के ऑयलिंग के जैसे काम करेंगे, जिससे इसका कैपेसिटी अच्छा करेंगे। बट ऐसे भी कुछ इंजेक्शंस है और टैबलेट्स है जो स्पर्मेटोजेनेसिस को इंड्यूस करते हैं। सो जो कम मात्रा में स्पर्म बन रहे हैं उनको मेडिसिन दे के पहले बूस्ट करते हैं, उसके बाद प्रोसेस के लिए जाते हैं जैसे टेसे और माइक्रोटेसे। अच्छा, हमने टेसे और माइक्रोटेसे कर लिया, ये सब प्रोसेस की, अब हमें कुछ स्पर्म मिले हैं। वो स्पर्म में कुछ स्पर्म रहेंगे जो मोटाइल नहीं है। तो हमें पता कैसे चलेगा कि वो लाइव है या नहीं? क्योंकि हमें स्पर्म का लाइफ कैसे समझेगा? स्पर्म की मोटिलिटी से। तो अगर स्पर्म हिल रहे हैं, मोटिलिटी है, अच्छी हो बुरी हो, लेकिन लाइफ वो स्पर्म की मोटिलिटी से पता चलता है। तो जो सैंपल हम टेसे से लेते हैं उसे हम स्पर्म मोबिल का प्रोसेस करते हैं, जिसमें स्पर्म को एक मीडिया में डाल के वो स्पर्म अगर लाइव है तो वो अट्रैक्ट कर लेता है और फिर उसके बाद वो मोटिलिटी दिखाता है। वो स्पर्म हम पिकअप करेंगे जिससे हम इक्सी कर सकते हैं।
सो देयर इज़ नो, ये
एंड,
एंड नहीं है ना?
करेक्ट,
देयर
देयर
इज़
इज
नो
नो
एंड,
एंड,
देयर इज़ नो एंड
यस।
टू दिस। नाउ आई थिंक सोसाइटी ने बहुत मर्दों पे भी प्रेशर डाल दिया है कि यू नो देयर आइडिया इज़ कि आपका ये काम है, गिविंग स्पर्म इज़ योर बेसिक नेसेसिटी, ओके? देन इट बिकम्स अ सोसाइटल प्रेशर, ना मर्द है, इतनी सारी चीज़ें आ जाती हैं। डू यू थिंक इन जनरल जब ऐसा सब कुछ होता है देयर देयर नीड्स टू बी अ लॉट ऑफ अवेयरनेस, कि वन औरत का सिर्फ काम नहीं है, इट फर्टिलिटी अलोन इज नॉट वुमेन्स रिस्पॉन्सिबिलिटी, बट ऑल्सो फॉर अ मैन it's not the end of the world. There are 10 things that you can do, there are 10 ways you can handle it, but as a couple, have you seen that this has happened but a couple has handled it really well?
So I would say I have seen this multiple times, but I would tell you, जब कोई लेडी फर्टिलिटी ट्रीटमेंट के लिए जा रही है वो ये ज़रूरी नहीं है हमेशा, लाइक ये सब वुमेन, एवरी वुमेन शुड टेल हर हस्बैंड, एंड एवरी हस्बैंड शुड नो दिस, दैट अगर लेडी फर्टिलिटी ट्रीटमेंट के लिए जा रही है तो वो उसकी बॉडी पे ये इंजेक्शंस ले रही है, मेडिसिन्स ले रही है, वो अपने हार्मोन्स को ट्रैक कर रही है, तो वो पर्सन का इंटेंट मैटर करता है। तो सबसे पहले ये उनके अंडरस्टैंडिंग होना चाहिए कि इंटेंट है इसलिए वो एफर्ट ले रही है। वो एफर्ट आपके अकॉर्डिंगली सही हो गलत हो ये दूसरा मैटर होता है, बट इंटेंट इज वेरी इंपॉर्टेंट फॉर अ कपल टू स्टे टुगेदर।
Very true.
If they are wanting to have a child, that's the best intent both of them are having. That's the family goal, the family value they have. But after that, everybody has their own thought process, so that has to be respected. पर्सन को अपने हस्बैंड का काम क्या रहेगा जब फर्टिलिटी ट्रीटमेंट वाइफ कर रही है, तो वो अपनी बॉडी को डिसफिगर होने के लिए अलाउ कर रही हैं, वेट गेन अलाउ कर रही हैं, शी इज़ गोइंग थ्रू लाइक वर्क एडजस्टमेंट्स एंड एवरीथिंग। सो हस्बैंड का काम क्या होता है इन चीज़ों में, इज़ टू बी अ फ्रेंड, टू बी अ कंपेनियन, and do what you can do. You cannot take her pain physically, but having that moral support, and women are quite sensitive. So, if and like, that's the best nature of women, that's why they are women. So, that is not wrong, but the sensitivity is about where they have emotion. So, that emotion has to be understood. The husband has to be available
Hmm.
emotionally, not only physically. Okay. And that doesn't mean getting carried away in emotion. Having light moments, go for a walk, start one exercise session together, go out sometime, take short trips. On weekends, just don't sit and watch TV and say I'm here only, right? So being there in the routine activities is the best thing that one can do as a expression of togetherness.
Right. So time spent karna or being present are two very different things,
Correct.
है ना? So a man, instead of saying, a husband in this situation saying ki I understand what you're going through, baby, I get it, but instead of saying that, showing up, right, showing up with your actions is way more important.
Yes, taking care of your health, like husbands having all the best lifestyle correction, along with that patience, and it should never get ugly. Like sometimes there are fights, you didn't do this, you didn't do that, or wife sometimes out of emotion. So I always tell husband and wife, all lot of, like I had a recently a very good actress, okay, Marathi actress. The day she got fail, she had come to me. The result was negative somewhere, she came. I said, see, today both of you are in so much of stress, and she was like having a lot of problems with husband. I said, see, today what you say, no, is just your emotional stress.
Hmm.
Just keep relaxed, patient. He is there with you, he cares about you. So both, it goes both ways. The husband and wife should be, in terms of stress, should be companion to each other and not to add to the stress. So the day result was negative, she had seen me. First thing was to, both of them should be relaxed. I told them that ki, this is not the right time for all discussion. It is not that ki, oh, the doctor is this is wrong, this is bad. The treatment has been done with good intent. Now, what has to be done further has to be understood as a team. And then we have to decide what next has to be done. And that is
Interesting.
where the couple relaxed. They understood, because every individual is intelligent, they understand, but you have to be making them aware of the situation, giving them insight ki, don't decide anything right now, just first process this, relax, then we will sit, so that you will be in a position to understand what next steps we are going to take.
On that note, Dr. Neelam, it has been an absolute pleasure. Honestly, we have spoken about my experiences, we have spoken about your experiences with your patients, and I'm sure so many people out here will look up to you, will look up to the hope that you've given and the guidance. So, thank you very much for that.
It is indeed my pleasure, and you really asked the right questions, and it was very wonderful interacting with you. Thank you so much.
Thank you.